Good day, ma'am. I am Karen Perbayubay, and my topic for today is Hansen's disease or leprosy. So let's proceed to the objectives. So objectives first is to identify what is Hansen's disease or leprosy. The number two, to provide an explanation of its signs and symptoms. Third, elaborate the treatments of the disease. Then present the causes of the Hansen's disease or leprosy. So as an introduction, how can you describe Hansen's disease or leprosy? So leprosy is a chronic infectious disease caused by a bacillus called Mycobacterium leprae. M. leprae multiplies slowly and the incubation period of the disease on average is 5 years after the scientist who discovered M. leprae in 1873. Leprosy mainly affects the skin, the peripheral nerves, mucosa of the upper respiratory tract, and the eyes. The disease is curable with multi-drug therapy. So, uh, the treatment must be multi-drug or madami siyang gina-intake na medicine dapat. So leprosy is likely transmitted via droplets from the nose and mouth during close and frequent contact with untreated cases. Untreated, leprosy can cause progressive and permanent damage to the skin, nerves, limbs, and eyes. So in addition to that introduction, leprosy or Hansen's disease also in year 2019 had 40 children a day diagnosed with this disease and 2 to 3 million lives with Hansen's disease globally. The most common bacteria of the disease is called E. coli, which has fast growth rate unlike the Mycobacterium leprae. So, did you know what leprosy have its forms? There are three types, but also doctors use these three types of simpler classification also. So the first form is tuberculoid, which is a mild, less severe form of leprosy. People with this type have only one or a few patches of flat, pale-colored skin or paucibacillary leprosy. The affected area of skin may feel numb because of nerve damage underneath. Tuberculoid leprosy is less contagious than other forms. So meaning to say, mas mild lang siya or mas madali lang siya magamot unlike sa ibang type ng leprosy. Next is lepromatose. It is a more severe form of the disease. It brings widespread skin bumps and rashes, called multibacillary leprosy, numbness, and muscle weakness. The nose, kidneys, and male reproductive organs may also be affected. It is more contagious than tuberculoid leprosy. Dito naman na type ng leprosy, more visible siya dahil sa mga skin bumps and rashes na kalat sa skin ng infected person. The third one is borderline. This type of leprosy is people with this type of leprosy have symptoms of both the tuberculoid and lepromatose forms. So, ito naman is a combination ng dalawang type ng leprosy, which is the tuberculoid and lepromatose. So, you may also hear doctors use this simpler classification called single lesion paucibacillary or PB or one lesion. Then paucibacillary or PB, 2 to 5 lesions. Then the third one is multibacillary or MB, 6 or more lesions. So what are the causes of this disease? It isn't clear exactly how leprosy is transmitted. When a person with leprosy coughs or sneezes, they may spread droplets containing the leprae bacteria that another person breathes in. Close physical contact with an infected person is necessary to transmit leprosy. It isn't spread by casual contact with an infected person, like shaking hands, hugging, or sitting next to them on a bus or at a table during a meal. So pregnant mothers with leprosy can pass it to their unborn babies. It's not transmitted by sexual contact either. So meaning to say, tulad din ng mga flu or something na communicable diseases, ang leprosy, mahahawa lang siya if um, any droplets like pag-ubo or pag-atching ng infected person ang pagkalat nito. So, if buntis ka, hindi man siya mag-transmit or mag-transfer sa unborn babies unless nahawaan siya by droplets ng sipon or ng ubo. Then, it is not also transmitted via sexual contact or intercourse. So for the signs and symptoms, leprosy primarily affects your skin and nerves outside your brain and spinal cord, called the peripheral nerves. It may also strike your eyes and the thin tissue lining the inside of your nose. So the main symptoms of leprosy is disfiguring skin sores, lumps or bumps that don't go away after several weeks or months. The skin sores are pale colored. So nerve damage can lead to loss of feeling in the arms and legs and also muscle weakness. It usually takes about 3 to 5 years for symptoms to appear after coming into contact with the bacteria that causes leprosy. Some people do not develop symptoms until 20 years later. The time between contact with the bacteria and the appearance of symptoms is called the incubation period. So leprosy's long incubation period makes it very difficult for doctors to determine when and where a person with leprosy get infected. So meaning to say, the more na matagal pa siya magiging or malaman ng doctor na may leprosy ang isang tao, the more na mas mahirap siya i-treat or i-cure. So meaning to say, mostly, it takes 3 to 5 years pa bago malaman na may leprosy ang tao dahil na rin sa incubation period na nangyayari. So for the leprosy treatment, leprosy can be cured. In the last 2 decades, 16 million people with leprosy have been cured. The World Health Organization or WHO provides free treatment for all people with leprosy. Treatment depends on the type of leprosy that you have. Antibiotics are used to treat the infection. Doctors recommend long-term treatment, usually for 6 months to a year. If you have severe leprosy, you may need to take antibiotics longer. Antibiotics can treat the nerve damage that comes with leprosy. Multi-drug therapy or MDT is a common treatment for leprosy that combines antibiotics. That means you'll take 2 or more medications of 10 antibiotics. The paucibacillary leprosy, you'll take 2 antibiotics such as dapsone each day and rifampicin once a month. Then for multibacillary leprosy, you'll take a daily dose of the antibiotic called clofazimine in addition to the daily dapsone and monthly rifampicin. You'll take multi-drug therapy for 1 to 2 years and then you'll be cured. So in addition to that, I have some disease diagnosis as an additional information about my topic, ma'am. So physical examination can be conducted by skin biopsy and immediate treatment if the illness is confirmed. The good thing, if you treated this disease ahead of time, you may prevent long-term impacts of the disease. There are 2 to 3 antibiotics called dapsone, rifampicin, and clofazimine, which you may take as a treatment. So, for the references, here it is, ma'am, in this slide lang po. So, that would be all po. Thank you.